Chapter 17, Nitrous Oxide. A few key facts. Nitrous oxide is a gas inhaled for its short-lasting head rush. It's an anaesthetic. It's popular in the UK and Netherlands in particular. It's inhaled, usually from party balloons. Timescale is very short. Intoxication lasts only as long as you breathe the substance in. Some effects include euphoria, slight dissociation, dizziness, nausea, loss of fine motor function, and headaches. Despite it seeming like a relatively modern concern, popular with young people at the moment, nitrous oxide, and even recreational nitrous oxide use, has been around for quite a while. In the 1800s, not long after its discovery, nitrous oxide was somewhat of a party trick in Georgian Britain. And that was largely due to Sir Humphrey Davy, the Cornish chemist and inventor, who was a lecturer at the hugely popular Royal Institution in London, and would go on to become president of the Royal Society. He promoted and demonstrated its effect via lectures, pamphlets, and even books. The gas would be handed round at highbrow gatherings, and London theatres even put on laughing gas evenings where members of the public could queue up to try it. What is it? Nitrous oxide is a molecule made up of 1 oxygen and 2 nitrogen atoms. At room temperature, it is a colourless, slightly sweet-tasting gas. Nitrous oxide is used extensively in the catering industry as a pressurised gas to whip cream, and is used in medicine as an anaesthetic and sedative. But nitrous is also popular as a recreational drug, its popularity evidenced by the number of whippets, small metal canisters containing the gas, found discarded in the streets of UK cities, certainly Bristol and Liverpool where I've lived recently. The statistics back this up. It's more popular as a recreational drug in the UK than in the rest of the world. In 2018, the Global Drug Survey found that 14.1% of people who responded to their survey reported ever using nitrous, with nearly 7% having done so in the past year. These numbers were even higher when just looking at the UK. The only country where nitrous is more popular than the UK is the Netherlands. This popularity may be due to the ease with which it can be obtained. Nitrous canisters can be placed in metal dispensers, sometimes referred to as crackers, that release the pressurised gas. Party balloons are filled with the gas and inhaled. What are the short-term effects? Nitrous intoxication is extremely short-term. If you stop breathing in the gas, you'll stop feeling the effect almost immediately. The sensations that people intoxicated on nitrous report are euphoria and potentially a slight feeling of disconnection from themselves. Nitrous can induce dizziness, so people using it are at risk of falling over. In rare circumstances, people can risk asphyxiation if they are inhaling the gas with their mouth and nose covered and they pass out. It can also make individuals feel nauseous. Headaches are a commonly reported after effect of a heavy session using nitrous. The gas can also impact on a person's ability to perform fine motor functions, like writing a text message, and this can persist for perhaps 15 minutes after they stop inhaling it. Individuals are at substantially more risk of harm if they inhale the gas directly out of the dispenser. Not only is inhaling pressurised gas directly into your face extremely dangerous, but there is further peril, because when the pressurised gas is released, it is at an extremely cold temperature. People who inhale direct from the dispenser can risk severe damage to their mouths and even their larynx or lungs, including frostbite. When used in a medical setting, nitrous is always administered with oxygen included in the gaseous mix. When recreational drug users fill a balloon with whipped cream propellant, this isn't the case. As such, there's an increased risk of hypoxia, a lack of oxygen reaching the tissues in the body. This can be highly dangerous, as if oxygen isn't reaching important organs like the brain or liver, damage can be done to them within minutes. What are the longer-term effects? Although nitrous has relatively low toxicity, and many people therefore believe it's a safe drug, regular use of nitrous oxide can lead to longer-term, and in some cases quite serious risks. There's some suggestion that it can be dependence-forming, although this is based on case studies rather than longitudinal studies, so whether this is a large risk or not is unclear. A growing concern in populations who regularly use nitrous is vitamin B12 deficiency. The nitrous interacts with the vitamin B12 molecule, which impairs it from functioning in the body. Mild symptoms of low vitamin B12 can include tingling in fingers and toes, numbness, and difficulty walking. In extreme cases, this deficiency can cause anemia, as well as impacting on the brain and cognitive ability, potentially even causing depression and dementia. There have been case studies of spinal cord degeneration reported in the past couple of years, which have been linked to recreational nitrous use, and there's some suggestion that the impact on vitamin B12 leads to damage to the fatty myelin sheaths that surround neurons, the cells found in the brain and the spinal cord. The myelin surrounding neurons is essential for enabling electrical impulses to pass quickly along the length of neurons, some of which are over a metre long. Although the rates of low vitamin B12 symptoms in nitrous users are not well documented, this is an important risk that people using nitrous need to be aware of so they can monitor their usage and ensure that they are not using so much that they become vitamin B12 deficient. Some users report taking vitamin supplements if they are using very heavily, but whether this would improve their levels is unclear. When the individuals in these case studies were asked about their use, they on average reported using nitrous 2 or 3 times a week at high levels. Some reported using over 100 whippets on a given day. Nitrous oxide is teratogenic. This means it is a drug that can disturb or disrupt the development of an embryo or fetus. Women who are pregnant or think that they might be may not be aware that this is the case, and risk damaging their unborn child if they use nitrous while pregnant. Myths and misconceptions. Hippie crack is more dangerous than laughing gas. Hippie crack is just another name for nitrous oxide, so there's no different in risk of using because it's the same substance. However, the name hippie crack is potentially misleading. Nitrous oxide is a greenhouse gas, and therefore individuals who want to save the planet and reduce the negative impact that climate change is having on our environment should probably think twice before accepting a balloon at a party. Although admittedly, the amount used recreationally pales in comparison to that generated by the use of fertilisers. Regarding the safety, although deaths from nitrous are rare, they're not unheard of. In the UK, Office for National Statistics figures indicate that in recent years, nitrous was involved in a handful of deaths every year. So, this is a myth. Nitrous causes intoxication by starving the brain of oxygen. When nitrous is inhaled without oxygen, the risk of hypoxia, where the brain can be starved of oxygen, is increased. However, this isn't what causes nitrous to have the effects that recreational users seek. If it was, maybe we could all simply hold our breath and get the same effect. When nitrous is administered in a medical setting, the ratio of gas to oxygen is required to be 50-50 to minimise the risk of hypoxia, as it can be extremely dangerous, as detailed earlier. So, it's a myth. Does nitrous oxide have medical uses? The short answer to this is yes. Nitrous oxide was one of the first anaesthetics. However, it has a rather unusual and slightly sad history in terms of its medical use. It was discovered in the 1770s by Joseph Priestley, after he heated iron filings soaked in nitric acid. He inhaled some of the resultant nitrous or dephlogisticated airs, as he put it, and noticed feeling giddy and less sensitive to pain. A few years later, in the 1790s, the Pneumatic Institution was set up in Clifton, the leafy area of Bristol in the southwest of England, to further research gases that were being discovered and whether they might have medical benefits. It was here that Humphrey Davy first encountered nitrous oxide, and after testing it on himself, he quickly came to refer to it as laughing gas. He initially believed the gas might be useful to treat tuberculosis, but in his 1800 book on the gas, he highlights that it could probably be used with great advantage during surgical operations. It's here the story of nitrous oxide takes a slightly unusual and quite upsetting detour. Despite this being a time in history without any safe anaesthetics, it took nearly 50 years for nitrous to become widely used in this way. In the meantime, it became extremely popular as a fairground attraction, or for use at laughing gas parties, a favourite with the British upper classes. A few individuals on both sides of the Atlantic tried to promote the use of nitrous as an anaesthetic during this time, but perhaps due to its image as a recreational drug were not taken seriously. Probably the best known of these is Horace Wells, a dentist from Connecticut, USA. He attended a demonstration of nitrous and noticed a man under the influence of the gas accidentally injure himself without pain. He and a colleague began to use the gas in their dentistry and found it to reduce or eliminate pain in their patients. He took his findings to Massachusetts General Hospital at Harvard University and gave a demonstration. While it was a partial success, it seems probable that the dose or duration of supply was incorrect in this instance, and the patient reportedly cried out. Wells was ridiculed, called a fraud, and ultimately not taken seriously. He took his own life a few years later. A remarkably similar story happened in England at around this time. A young doctor called Henry Hill Hickman experimented with the use of nitrous for anaesthesia on animals, and believed it could revolutionise human surgery. He presented his idea in both England and France, going to speak to the Royal Academy of Medicine in Paris, but he was not taken seriously. His early death at 29 years of age prevented him from pursuing the idea further. Eventually, interest in the use of nitrous was rekindled, particularly after the rise in popularity of chloroform and ether and the high risk of overdose from them. Once techniques were developed to allow the administration of nitrous alongside oxygen, the use of the gas as an anaesthetic, analgesic, and tranquilizer became more popular. These days, nitrous is less widely used in everyday anaesthesia, mostly because it can cause nausea, which people report as unpleasant. However, it does have uses as what is known as a carrier gas. It's not able to induce general anaesthesia by itself, but if it is combined with another anaesthetic, it can aid the uptake of the other gas and deepen its effect. It means less of the other anaesthetic is required to achieve the same result. It's still used in obstetric practice. You've probably heard of gas and air being given to pregnant women to help with pain during childbirth. This might make it sound perfectly safe, but there are a number of mechanisms in place to ensure that it doesn't cause harm, even in this controlled environment, with medical supervision readily on hand. Women are given a device to allow them to self-administer the gas with an on-demand valve. This means that should they inhale too much and fall unconscious, the valve will be released and the supply of gas will stop. A couple of breaths of air and a person will no longer feel the effects of the drug. Nitrous can also be useful in accident and emergency departments. A person can take a few breaths of nitrous and oxygen and potentially have a dislocated arm reinserted without pain or distress, as it causes sedation and pain relief. What don't we know? Given nitrous was discovered in the 1700s, it's quite surprising how little we still know about how it works and anaesthetics in general. This brings us to the so-called hard problem of consciousness. How and why do we experience consciousness, and how does it manifest in our bodies? In his excellent TED Talk, neuroscientist Anil Seth describes his experience of going under due to anaesthesia as feeling akin to ceasing to exist. He defines it as distinct from sleeping, as when you awake from a sleep, you have a sense of time having passed, while this isn't the case when waking up from anaesthesia. We don't understand the links between our physical brains and our mental states anywhere near well enough, and as such, it's hard for us to understand how drugs that impact on consciousness cause this effect. Whole books have been written about this from both philosophical and scientific perspectives, but I'm afraid they don't, and I certainly don't, have the answers just yet. Anil Seth used his TED Talk to propose that all of our perception is a controlled hallucination, but there's still a long way to go before the hard problem is solved. Focus on psychedelics. The term psychedelic was believed to have been coined by a psychiatrist called Humphrey Osmond, and is from the Greek words psyche, meaning mind, and delune, meaning to reveal or make visible. So the term psychedelic means soul-revealing or mind-manifesting. Psychedelic drugs are those that alter perceptions. Visual changes or changes in the ability to perceive time are common. Which drugs are psychedelics? LSD, magic mushrooms, psilocybin is the active compound here, mescaline, found in cacti, DMT, 2CB, and a whole host of less common synthetic substances related to it are all classed as psychedelics. Salvia is sometimes considered a psychedelic due to its perception-altering qualities, but chemically it's quite different to these others. At a molecular level, there are two different types of psychedelics. Drugs that cause a perceptual altering or mind manifesting, as the term psychedelic means, effects, tryptamines and phenethylamines. Simple tryptamine molecules, in particular DMT, very closely resemble the molecular structure of serotonin, a neurotransmitter found throughout our brains and bodies. Psilocybin, LSD, and DMT are all tryptamines. The other class of psychedelics is phenethylamines. This includes mescaline and synthetic psychedelics such as 2CB, DOM, and 2CT7, although it also includes a number of other substances you'll find throughout this book, including MDMA and amphetamine, and also the neurotransmitter dopamine. What effects do psychedelics have? The key features of psychedelics are that they alter perception. Psychedelic intoxication is often associated with kaleidoscopic artwork, patterns repeating and folding in on themselves, and colours exploding off the page in a vivid rainbow. Sounds and vision can become linked, akin to synesthesia, where senses are connected. Perceptions of time and space can also become distorted at higher doses. Patterns, when looked at, can appear to pulse or move about. Depending on the type of psychedelic, hallucinations can replace what is really there or sit superimposed on top of normal vision. Psychedelics can also impact on mood and emotion. This can happen both during intoxication and potentially following it. Some people who use psychedelics do so because they believe it will change their perspective about their lives. A number of psychedelics, including psilocybin, are being investigated as potential treatments for mental health problems such as depression. Psychedelics do not tend to be dependence-forming, although it's not impossible to develop problematic use of psychedelics. People who use psychedelics tend to do so sporadically. Regular use of a psychedelic might mean using it once every month or two. If you take a psychedelic immediately after a previous dose, the second dose will have no effect as tolerance to the substance builds up quickly. There's some evidence that psychedelics are unsafe for people who have a high risk of mental health problems such as psychosis. A psychedelic trip could trigger a psychotic episode in people vulnerable to them.